Meridian Behavioral Healthcare, a place to promote the health, recovery, and well-being of those affected by mental illness and substance use disorders through prevention, coordinated treatment, and supportive services. It all started in July of 1971. After receiving a staffing grant, the North Florida Community Mental Health Center was established as a private, tax-exempt entity. Between 1972 to 1978, additional grants for alcohol abuse, residential services for children, and services for the elderly were awarded to the North Florida Community Mental Health Center. In 1979, the 10-county zone of North Florida Community Mental Health Center was divided into two. During the 80s and 90s, both Community Mental Health Services and North Florida Community Mental Health Center continued to evolve and grow. And in July of 1996, Community Mental Health Services and North Florida Community Mental Health Center unified to become Meridian Behavioral Healthcare.
I've seen a lot of changes at Meridian since I've been here. When I came to Meridian, we were a 4-county operation, meaning that we were serving people in Alachua County, Dixie County, Gilchrist County, and Levy County. We expanded from those 4 counties to over 12 counties now that we're providing services to.
Further growth paves the way in the opening of the first opiate treatment program in North Central Florida in 2005. Short-term residential treatment program follows in 2006.
Back then, our services were all Gainesville-based, but our catch area goes out probably, you could say, Jasper and that area is 100 miles plus. So there's these huge outlying areas with no access to this kind of care. And because of limited funds, they couldn't get transportation in. There's almost no public transportation.
Throughout the years, Meridian continues to expand its services for women, men, and children. Over the next several years, Meridian advances its mental health offerings, further expanding its behavioral health service departments, starting a unique co-responder program, initiating acute care and residential facilities, and the expansion of telehealth services.
As we expand both in breadth and depth of our services, it's really because there is a gap in healthcare, and we are well suited to fill it.
Our staff that work in those communities live in those communities, so it's really important to our staff that we serve those communities in a meaningful, impactful way.
During the COVID-19 pandemic, Meridian proves its abilities to adapt, innovate, and thrive.
When the pandemic started and really became evident that things were about to change and we weren't going to be able to provide services in the same way, we were able to switch very quickly to telehealth and really provide the continued services that children were getting and families needed throughout the process, and we continue to do so today.
The community sees Meridian as a beacon of light because we provide that hope, that recovery, and that well-being that they truly need in the community right now. And if we provide that to at least one person, then that benefits the community.
No agency gets to 50 years without dedicated staff. And it doesn't matter where you are, on what level, what position you're in, everything is so critical.
Each and every single one of our employees, our partners, our people are at the heart of what makes Meridian Behavioral Healthcare what it is today. If you can help and if you can do it. And that's Meridian's Behavioral Healthcare's mission. We are restoring, reviving, reawakening, giving back hope to people that don't have it.
As a result, Meridian has expanded coverage from the original 10 counties in 1971 to become the largest comprehensive provider for essential mental health care and treatment of mental illnesses and substance use disorders in North Central Florida.
I believe in the next 50 years, Meridian's going to grow bigger and better, and I'm so proud to see that Meridian is making the effort to go where the people are and where the need is.
Throughout the years, the focus of our mission has remained. We have prioritized access to quality care, community problem solving, and maintaining a continuum of essential healthcare for everyone. Meridian, regarded as the highest point of health and vigor, your prime,